Tag TV and Tag Radio be seen and heard by both technology users and technology producers throughout the state of Georgia and around the world. Low cost, big benefits, powerhouse online branded video and audio has arrived. Tag TV, Tag Radio, there's a lot more to know. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions. Did you know that Georgia is the nation's health IT capital? That's right. Our state's health IT companies produce more than $4 billion in annual revenues, $4 billion with a B, and are growing at a 40% rate. One area of medicine where Georgia leads in innovation is oncology. That's the field of medicine that deals with cancer diagnosis and treatment. Just a little more than 5 years ago, experts were reporting that cancer caused about 13% of all human deaths worldwide. That's nearly 8 million people. And the rate is rising as more people live to an old age and as mass lifestyle changes occur in the developing world. One Georgia company is changing the treatment paradigm for oncologists and their patients and putting our state in a national leadership position where this kind of oncology technology thrives. Greetings, everyone. It's Tuesday, August 28th, 2012, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. Where Georgia leads the nation, albeit the world, is oncology with Velocity Medical Solutions, an industry-leading software tools that facilitate planning, treatment, and review of radiation therapy for cancer patients. Cancer patients worldwide are benefiting from the innovation that Velocity brings to planning and delivery of radiation treatments. What makes the Tech Talk focus on this innovative company? The concept and the development of the technology took place right here in Georgia, and it is now being used in 150 treatment centers across the globe. Up to the Tech Talk, Michael Crocker, Velocity Medical Director of Marketing. Michael joined Velocity in 2009. Since with the company, he has been involved with a number of aspects of the Velocity platform and has been responsible with deploying the technology into different luminary sites across the United States, including Duke University and MD Anderson in Houston. Innovation, cancer treatment, oncology, and world leadership. That's what Velocity Medical Solutions is all about. As Tino speaks to one of the health IT companies where Georgia leads, Velocity Medical Solutions Director of Marketing, Michael Crocker.
Michael, thanks for joining me on Tech Talk today.
Hey, thanks for having me.
Let's jump right in. Our listening audience, I'm sure that many have heard about Velocity Medical Solutions, but bring that to life a little bit. What's the company do?
Yeah. So, really, Velocity Medical Solutions is, an oncology imaging informatics company based out of Atlanta, Georgia. We've designed some software tools. Really, our flagship product, Velocity AI, which stands for Velocity Advanced Imaging, is a biologic image processing software platform that enables oncologists or cancer doctors to, really get a better understanding of how patients are responding to treatment, thus allowing them to, modify or adapt, that treatment to lead to better outcomes for the patients.
Interesting. And what did this come out of a university setting, or how was this first developed?
Yeah. We really got started through collaboration with the radiation oncology department at Emory University, and the group at Emory was struggling with trying to incorporate biologic imaging like, PET-CT or MRI into the treatment planning process for both upfront tumor targeting and response assessment. And so really we licensed some technology out of them, and Velocity spun off and really started selling a platform commercially towards the beginning of 2009. And at that point in time, we had about, 5 installations. Now we have close to 250 installations worldwide. So we've grown pretty significantly over the past couple of years.
Yeah, that's terrific. And so you're clearly solving a problem that the physicians had. What is it, in layman's terms, how does this look different than what, say, a doctor would have used prior to your new technology?
Exactly. So, really what's going on in cancer treatment today is that, there's more and more imaging being used in the clinic. And this imaging is being acquired at all different points in time throughout the patient's treatment life cycle. And there's different modalities of imaging being used. Traditionally we had x-rays, and then that evolved into CT scans. And then from those anatomic scans, you sort of saw this rise in biologic imaging, things like MRI, PET CT, SPECT CT, that really give you, a better understanding of the biology of the tumor. And so on top of, more imaging being created from different modalities, patients are also living longer. So they're getting imaging acquired at, different time points, and maybe, an image acquired every year. And so really what's nice about Velocity and sort of our core technology is the ability to bring together imaging regardless of the source, so that physicians can compare that imaging a lot easier and extract meaningful information to help with outcomes from all of that imaging data that's being generated in the hospital or clinic.
And this reduce the likelihood of surgery, or what's the improvement care to the patient? What's the end result for the patient on this?
Yeah, really I think as more advanced imaging has come online in the clinic, this gives physicians a better perspective into, where a tumor or where disease is located in the body. And so on the front end, utilizing Velocity, we can get a better understanding of where that disease is, so that when we, initiate treatment, we have better upfront targeting. At the same time, we can now, a couple weeks into treatment, regardless as to whether or not a patient's getting chemotherapy or radiation oncology, get a better understanding of how that patient is responding to the treatment. And, as we know, everyone is sort of created differently, and some patients respond better to different drugs or courses of treatment. And being able to understand that information, 2 weeks into treatment rather than 6 months post-treatment, can really help with the outcomes of the patient.
So that's really important. We're glad that this is in Atlanta. What's the future look like, first of all, in terms of the company? Like, how many employees do you have, and are they all based in Atlanta? And as you grow, will a lot of that be in Atlanta? Also, you talked about the software. Is there actually a hardware piece to this that you're developing? And asking a long-winded question here, but where is it developed? Is it manufactured in the area or?
Yeah. So really, like I said, when I joined Velocity, I was employee number 3 in January of 2009. At this point in time, we now have over 30 employees working for the company. Yeah, so we've created jobs. A lot of those are in Atlanta, and what's been nice is that you have really good institutions like Georgia Tech and the computer science program there, where we've been able to get engineering talent to bring into the company. I think that in terms of hardware, one of the things that's nice about Velocity is we pride ourselves on being vendor neutral, which means we sell software, and you could basically load that software on, any type of PC, any type of laptop, and really what we see, sort of big in the future is sort of mobile and cloud computing. And, I can expound on that a little bit further, but I think, we really don't see ourselves as a hardware company. I mean, in the clinic, what you're seeing now more and more is people trying to get away from the traditional hardware and maybe go more into like a cloud-based environment or a virtualized environment. And so Velocity's kept pace with those changes that we're seeing in the overall healthcare setting.
So, I think we have time for one more question. So let's probe a little bit deeper in respect to the mobility and some of the other things coming through in the future. So how are doctors' offices making the shift?
that's a perfect lead-in to where Velocity is putting a lot of our development. And actually, we have a new product coming out this winter, and it's called Velocity Connect. And essentially, it integrates the concepts of cloud computing and mobile applications to really what we believe to be raises the standard of patient care. And so, when somebody has cancer, they may go and see 4 or 5 different specialty physicians. You may see a head and neck surgeon, you may see a radiation oncologist, you may see a medical oncologist, and then maybe you saw, your internist. And so as you're getting treated, you're seeing all of these different types of doctors. And really, Velocity Connect enables those 4, 5, 6 different physicians to collaborate on that image and really provides a sort of new standard of collaborative care, which without a product like this and using things like cloud computing and mobile applications and giving people sort of anytime, anywhere access to that data, really making it on demand. You don't see that. So we're pretty excited about the future of Velocity with Velocity Connect and really just giving doctors a better way to collaborate with one another and a better way to collaborate on their patients.
Well, that's great. I think your company was a top 40 company for the summit. Was that right? Or?
Yeah, definitely.
Yeah, that's what I thought. Well, congratulations on that. That's a prestigious honor. You guys were selected for that. And thanks for joining me on Tech Talk today, and looking forward to hearing about your progress moving forward.
Yeah, hey, really enjoyed it, and we will definitely keep you guys on the loop with what we've got going on at Velocity. I think it's going to be an exciting next couple of years for us.
Looking forward to it. Thanks.
Thanks for your time.